I was visiting Cuba a while back with a friend of mine, and a friend of mine was mugged while we were there in Cuba, and she was beaten up pretty badly. That's not so great to be in the back alleys of Cuba. The other benefit, though, was that she got free health care for having been mugged. That would be a great thing to see in the streets of New York. Oh, you've been mugged? No problem, free health care here.
Yeah.
Well, a couple years ago, I was working I was in college and I was working part-time at a hardware store, a local hardware store, and I tried to get insurance coverage through New York State. And I went in and they said that I didn't qualify for free insurance just because I didn't have, I worked too much. Basically, I worked 4 days instead of 5 days. So I could qualify for $175 a month. I could qualify, I could get a lower insurance. I could pay a little bit less. And, or I could stop working one extra day a week for no reason at all. I asked her, I said, do I have to have a back problem or something? And she said, no. And she said, no, you just have to work 1 day less a week. And then you could get free insurance through the state. And I was like, but I don't want to work 1 day less a week. I want to work.
Right, exactly.
Whatever. So that was really, really irritating. So that's my little...
Yeah.
Should I just say?
Exactly, just whatever.
My dad lived in Canada for the second part of his life, and the last year of his life, last year, he was well cared for by the health care in Canada, and I'm so grateful because my stepmom is not broke, she's okay. He was well taken care of, and she's not left destitute.
Thank you.
Okay.
Until I was 21, I lived in England, and I lived there since a few years. And my wife had a baby there, and there's really nothing to be afraid of. It's a perfectly good system, just as good as it is here, and you don't have to think about insurance or paying. It's entirely worry-free.
Thank you so much.
Well, I had been working part-time and my husband was working full-time, and so I wasn't eligible for insurance, and I was on Healthy New York, but then we started making too much money, so I lost my Healthy New York coverage, so I was uninsured again. So yeah, I guess that's about it.
Important.
Just keep going.
Okay, hi, I'm John Paul Mead. I'm a physician here in Ithaca, and I gave a talk at the medical center here about single-payer healthcare last December. I'm a member of the Physicians for National Health program, so I'm fully in support of the ideas and legislation moving towards single-payer in this country. I am personally work in a primary care office, and I can say that the for-profit insurance companies and even the not-for-profit companies like Excelis that work in this part of the state are basically putting us out of business. We have to hire more staff to deal with all of the denials and paperwork and patient complaints. Patients are always angry with us because they can't get what they want, and 90% of the time it's a problem to do with their insurance or their drug card or etc., not to do with our care of them. So we've become managers of bureaucracy rather than healthcare providers. So it's a pretty sad situation, and it's something that makes me want to change my career sometimes, but I'm sticking with it, and I'll be here.
Great, thank you so much.